Yes.
Okay, so the first thing you do is completely take it apart, leave the plastic pieces on, and take all these pieces out, and open the boot up. You size the boot by placing their foot in it and making sure that the heel sits right where the curve is. The ankle bone should be more or less right underneath the stays here. So the ankle bone should be in between here. And their toes should not be probably more than about 3/4 of an inch back behind the edge of the metal. So this one looks like it fits her pretty well. And you should not see the toes sticking over the edge. Then you take the boot completely apart, you take the straps off, set them up there. I don't usually use this piece because I don't think it's very helpful. If they have a lot of pain because the straps are concentrating pressure right on that area, this will help decrease that, but I find that this is just in the way most of the time. So I usually dispose of it. You take the cuff and put it the edge of it should be just above the ankle. And it should set so that the Velcro is on the front side of the ankle so that they can get it on and off real easily. Then you take the boot, and sometimes this boot has a curve to it. And sometimes, especially if they have any ankle swelling, that can really press against their skin. And I've seen people actually get ulcers from these edges. So a lot of times I find that you got to bend them. Some of the girls don't have enough strength, but you just kind of bend it out like that, and then you put the palm of your hand right where the bend is along the stays, and you kind of put a counter bend in it so you get it more or less straight. And these are nice because they're metal; they bend real well. The other ones, those Briggs, don't. They're plastic, and so you can crack them off if you try to do this with the Brigg. So that one's pretty straight now, and so I fit the U-shaped piece. And I don't find that these molecular pads, these single pads, to be very helpful ever, really. You fit this in, so one pad is on one side. The back portion should be right in front of the back of the platform here, and you put the other part in the other way, and you more or less just kind of fit the heel so that it sits right in the back, again with the ankle bones in between the stays, and the heel really should be right where the elevation kind of flattens out back in here. And then I usually use my knee to kind of fit it on there. We want the stays to come up along the side, and then you just pull the plastic pieces out. And that should keep it pretty nice and still there. You put these tags in through here. The pad here should be centered more or less on the top of the foot, and it should come over the top. Straight, yeah, straight. You want to make sure that these don't rub on the front of the ankle because that can be a problem. If they do rub on the front of the ankle, then you take this pad completely off and you just set it a little bit more like that. The other possibility is that you just have the ankle too far forward if that's the case. But you can set that pad, you can realign that pad if you want to. Now at the very end, you want to cut all this stuff off. You don't want these to be hanging out there. It's just sloppy when you do that. Okay, and then we take these, and I'll show you some tricks about that. Yeah, I'm gonna put them all out there, mix them all up. So these are all different lengths. And if you're like me, you usually get them mixed up by the time you're done. So the way that you put them on is you kind of hold them out here, and you can figure out which one's the longest one. So you grab them all, kind of put them all together, and you find out which one's the longest one. and this one looks like it's the longest one. When you're putting these on, keep the Velcro, the rough part, on the outside, because if you put it on the inside, it won't strap on right. So, and I always put the buckles on the same side of the boot at about the same place. You don't want one buckle here and one buckle over here, because it gets real confusing when you're taking them off. So Velcro rough part on the outside, place it on there, squeeze it together slightly, and then you bring the buckle around like that. And then you find the next one, which is the middle one in size. Again, Velcro on the outside, buckle in front, squeeze just slightly, strap it on like that, and then you put the third one on. What was that? Okay, well, it'll look about right anyway. Okay, and now we've got it fit correctly. Now sometimes for some people, especially if they're like post-operative, they won't have good range of motion, so their foot will not sink into this. You have to actually have about 5 degrees of dorsiflexion in order to get your foot into this comfortably. And if someone is not able to do that, then you can help them by placing a pad in the heel of the shoe, so it elevates the back of their heel slightly, and it makes it more comfortable for them to be in the shoe. They don't feel like they're just pulling it up. And so we just use these hay pads. Usually I'll use the half or the 9/16. This is a 7/16. It doesn't matter. I like to use the 3-inch in the boots because they fit a little bit better. And if you're doing a hay pad for a shoe, you probably want to use a 2.5 or 2-inch one. But for the boots, the 3-inch ones will fit into the boot best. And what I do is I take the hay pad out, and you can put as many as 2 of them in there, so you can make up to 1 inch of height in there. Can I borrow a pen? And this is the way that we take the adhesive off. These all have adhesive backing on it, and you don't want to take the whole adhesive out, because if you put it in the boot with all the adhesive out, it's really hard to take it out. So I take an ink pen and I score it about 1/2 inch from one side and 1/2 inch from the other side, and I just take that amount of adhesive off. We just take the adhesive off of 1/2 inch from the front and 1/2 inch from the back, and that's usually enough to get it to set securely. And if you need more than you can get, if you need more elevation than you can get from one heel pad, you can stack them on top of each other in the same way.
Now, eventually, will the patient just kind of take these out?
Right, you can pull them out, and it's a lot easier to get your finger in there and pull them out, and to get them out without leaving a bunch of felt in there. If I mean, the other alternative is to use a wedge walker or one of the Achilles boots, and then you have the heel pads there.
Mm-hmm.
But if you don't have them, and sometimes our inventory is running short, or for some reason we don't have one, you can do this instead. Or if they bring a boot in, you can do that. So next one we want to try is the brake.
But most